Hello, my friends, and welcome back once again to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And how do you like it? How do you like the Patient First Podcast? I've heard some great feedback recently. Just won the Editor's Choice Award for the dentalpodcast.org. And I'd let you know, if you are a fan of the show, share it with a friend. You know, there's lots of people in dentistry or like dentistry that would like to hear about it. If you have some comments or suggestions, I'd love to hear them from you and hear more and more from our audience. And it's just so fun to hear what everybody has to say. And today, every once in a while, I use this term because I'm a child that grew up in the 80s. And when they would say a very special episode of, and today, my friends, we have a very special episode of the Patient First Podcast. Why? Because we're going to do one of my favorite things to do. Now, my favorite segment is Books Applied to Dentistry. Unfortunately, that is not today, but we are doing one of my favorite things to do, which is to have people look at something that's been under their nose for quite some time and look at it from a totally different perspective. And I think we're going to do that for almost everybody who's involved in dentistry today. And that question is, what is a PMS? For those who aren't in dentistry, I'm talking about a practice management system. So, what is a PMS? What is a practice management system? What does this even mean? Have you ever thought about that? I don't think that there is a term thrown around in dental technology, which is obviously I'm a big fan of, a term that's used more than the PMS system. Ooh, what PMS do you have? Oh, do you integrate with the PMS? Right? So let's break it down today. What does a PMS even mean? Well, my friends, I would say that it means really nothing. Most practice management systems are a bunch of features that somebody slapped together, usually at least 20 years ago, sometimes 40 years ago. And those features set put together, they call the practice management system. So I don't think PMS means anything, and it's shocking because we use it all the time. So it's really the core software platform that you're running your dental practice on. But is that really what you're talking about when you say, does it integrate with the PMS, or what PMS are you using? Because that really, what you're really saying is, what feature set did you buy that somebody slapped together? And if you disagree with me, again, I'd love to hear your comments below. But because I believe there's a better question, and that is, what is an electronic dental record, an EDR? And we'll talk about why the PMS and the electronic dental record are not the same, are not the same, because well, we'll talk about that in a little bit, but usually people are using these interchangeably. Now, dentists don't even usually say an EDR there, and there's an EMR, an electronic medical record. Usually dentists talk about their PMS, but again, what the hell is that? It is a bunch of features that you purchased and that you're running usually in your practice most of the time, right? That's what a practice management software really is. Contrary to that, electronic dental record, an EDR, is actually defined. Our good friends at the ADA, the Standards Committee, of which I'm heavily involved right now, have actually answered the question with one of my favorite tools, standards. Standards are important. They align a profession on many things. In this case, ADA Standard 1084 defines what an electronic dental record is. And actually, I'm going to be part of a work group, I think, that's going to be revising this because there's some new information that's come available. And as like all standards, they have to be updated with time. So why does this need to be updated? If you look at ADA 1084, is that in line with what a practice management software does? Some cases yes, some cases no, but I would argue that the PMS is way more outdated than what the definition of the EDR is, because there is so many differences. So the reason why we need to revise 1084, and this might sound like semantics, like for those of you that aren't involved in standards, you might be thinking, oh my gosh, this makes no sense. Why am I listening to this? Right? It's important, and it's important because let me give you a use case. At Opera DDS, the platform that I sold Divine Dental a couple of years ago, about a year and a half ago, we had a medical history that one of the major PMS system, again, the slap together feature set, would not allow us to write back into the medical history. Why? Because they wanted you to buy their medical history forms, not Opera DDS's. Illegal today and immoral, anti-competitive, monopolistic behavior, but I digress. The medical history that the patient filled out in Opera DDS did not write back to that practice management software purely because a business case that that company had. Is that medical history in Opera DDS part of the electronic dental record? Absolutely yes. Is it in the crappy PMS? Absolutely no. So the electronic dental record is really a subset of data that can live in multiple places, including paperless forms, whether or not they integrate with your practice management software. Want me to complicate things a little bit more? What about your imaging system? Most PMS systems got rid of creating an imaging system because why? Because imaging systems actually need to be updated with time, whereas a billing system really doesn't need to be updated that much. So it's easier just to outsource that to another application that links with your practice management system. So your patient's images are actually stored outside of the practice management system. So are x-rays part of a patient record? You're darn tootin' they are, right? So it isn't in your PMS. It lives outside, just like medical history forms or paperless forms that don't write back to your PMS system. How about a CAD CAM system? Let's say you have a CERAC or iTero or a 3Shape. Do those scans constitute part of the electronic dental record? I think so. And if you want to join me on the ADA Standard Committee to answer decisions like this, shoot me a note. What about CT scans or recall information? These are all decisions we have to make, and I'd love to hear your feedback on it. It's all part of the EDR, in my opinion, and it has yet to be fully defined. However, these things won't be living inside some practice management system that was designed 40 years ago, literally 40 years ago in some cases. So and like if it was designed 15 years ago, that's probably new for the software that you're using. So my friends, what is a PMS? It's really the software that's sitting in that server in some closet in your office that is some feature sets that acts, my friends, as a data prison that really locks in your patient's data. Okay, very key to this is that this information is legally owned by your patients, that you're the stewards of. And, others, lots of systems out there. Just walk the trade show floor. The one, the one system you need, somebody one, all in one system. Everybody says the one system for this. Nobody can do anything even partially well in dentistry when it comes from a software perspective most of the time. So all that does is make you get subpar products that you're paying more for. And then you have limited access to that data yourself. And your patients, when they ask to get their files, good luck giving it to them, right? There's two big victims in this data prison. It's patients and it's practices. And the reason why we talk about it here on the Patient First podcast is that's who we are advocating for practices and for patients, and creating integration with the most innovation companies in dentistry. Now, how about this? Why can't we bring in the medical history from medicine and look to see and make sure that what the patient said to you verifies with what has happened at their physician's practice? That is now capable today. One big reason is that there's the 21st Century Cures Act that you will be hearing a lot about, both on this podcast and out in dentistry at large and medicine at large. It's the rule that prevents information blocking within electronic health information. So that means that it is illegal to not allow you as a dental practitioner or the patient to have access to their own data. And today, almost nobody's complying with it. And I was just at the Health Data Palooza last week, heard the head of the ONC, Dr. Mickey Tripathi, talk. Each one of these fines, a single fine, single, single, a single instance of violating this has a fine of up to $1 million. So they're serious about this and they're assembling the team to go after companies that are doing these information blocking practices. So if you don't like what's going on with your practice management system, report them to the ONC. They'll probably care. What we're doing at Toothapps is trying to solve this, right? We have open sharing that's secure, where we allow you and your PMS system, your radiographic systems, your QuickBooks, your payroll company, all you have access to all of that seamless information. And there's lots and lots of downstream positives of that. For example, you'll need one login for everything. If you choose, you can get one bill for everything. With a click, you can install something with no IT companies. Full interoperability, meaning we bring over the necessary information from medical so that if a patient says they don't have diabetes, but they were just diagnosed and it was put in their Epic record at their physician's office, you'll get notified so you can have the conversation with the patient. And importantly, bringing down the cost for dental practices in a big way. I won't go too deep into it, but the companies that say they're all in one, all they're doing is charging a tax on everybody, patients, other software vendors. It's ridiculous how much wasted money is spent on these monopolistic behaviors. And by the way, you should be able to run your practice from your phone, right? That's what we do at Toothapps. So we bring it all together because we're doing what's called interoperability or sharing of data from that's again legally owned by your patients and you are the stewards of. And the main three things that we do at Toothapps to help with this is we have Toothapps Connect that connects all of your data together, the patient's data with all of your other applications that all plug into one spot, a fully integrated calendar. So you can do billing directly from your mobile device. You can look at your EagleSoft calendar, your schedule of patients right next to your Google Calendar and your HIPAA training calendar. And then, of course, messaging throughout the entire organization, inside your organization, outside your organization, and getting alerts from everything, all the alerts you need securely in full HIPAA compliance through what we call Toothapps Forum. We like to say we're giving you a get out of jail free card because you can start at toothapps.com/go for 14 days for absolutely free for the time being. You can connect all of your applications in one unique spot, get a fully integrated calendar, be able to message both within your team and outside your team for free. So get out of the data prison that people are federally mandated now to get out of through the Cures Act and join the movement at toothapps.com/go. Thank you very much. And of course, as always, I look so forward to seeing you right here next week on the Patient First Podcast.